Hi, I'm Ryan Nutter, CEO and Principal of Cornerstone Senior Advisors, and in this video I want to discuss with you just a little bit of the options that you have to beef up your health insurance, beef up your coverage when you have a Medicare Advantage policy. When you have Medicare Advantage plans, they do have some out-of-pocket exposure, and there are policies out there that you can purchase that will help beef up and limit your exposure with those plans. The first one I want to discuss with you is hospital indemnity plans. These hospital indemnity plans, you could say, are to Medicare Advantage like Medicare supplement plans are to original Medicare. Maybe this is just me trying to be clever, but the long and short is hospital indemnity plans, they fill the gap that are left by Medicare Advantage plans if you're admitted to the hospital. This is one of the costs that often concern people with Medicare Advantage plans, is the amount of cost that they could end up spending when they are admitted to a hospital. But if you combine one of these hospital indemnity plans, which are pretty inexpensive, with a Medicare Advantage plan, it really limits your out-of-pocket exposure pretty greatly. So how does a hospital indemnity plan work? A hospital indemnity plan is actually going to pay you a certain amount that you choose for a certain number of days, which you also choose. So you can choose your benefit amount, and you can choose how many days they're going to pay you that benefit amount that you're in the hospital. So let's look at an example. If you have a hospital indemnity plan and it's going to pay you $300 per day, and let's say it'll pay you for up to the first 6 days. And then let's say you have a Medicare Advantage policy and you have a copay per day in the hospital of $250 for the first 5 days. Well, if you're in the hospital for 4 days, you've racked up a bill of $1,000 because you have a $250 per day copay with your Advantage plan. But since you have a hospital indemnity plan, which pays you $300 per day, you're actually going to get a check from that company of $1,200, $1,200, and then you can use that check to pay off your hospital bill so you don't have to worry about the out-of-pocket exposure in a hospital, and you can basically just think about recovering. I've had clients for several years that have used these hospital indemnity plans, and they've really been a great benefit to them because they don't have to worry about their out-of-pocket exposure while they're laying in that hospital bed. All they have to think about and focus on is getting better. The other thing I'd like to discuss with you are cancer, heart, and stroke policies. These cancer, heart, and stroke policies are actually becoming very, very popular. And this is a policy that's going to cover you for 3 of the most common health issues that have very expensive consequences. The policy, a cancer, heart, and stroke policy, will pay you a benefit amount that you choose when applying for coverage in the event of any one of these health conditions happening to you. So just like the hospital indemnity plan, the insurance company is actually going to pay you a check. So let's say you select a benefit amount of maybe $15,000. If you are ever diagnosed as having cancer or have had a heart attack or a stroke, you're going to get a check for $15,000, and you can use that $15,000 however you see fit. So to paint a picture of why this is an important policy or can be really beneficial for a beneficiary, let's talk about the numbers. And this can be kind of morbid. They're not fun to talk about, but this is just the reality of why these policies can be effective. 1 out of every 4 deaths is caused by cancer. It's the second most leading common cause of death. 77% of all cancers that are diagnosed are in people that are 55 and older. And we all know cancer can be really expensive, but it's not just your copays or deductibles. You can think of things like oral chemo medication that can end up costing thousands a month, or other things that aren't really healthcare related, like travel to receive treatment, hotel rooms and fuel and food and things like that. Well, that's where when you receive a check of $15,000, you can use that however you see fit and use that for things that are not even healthcare related, but can add up in expense while you're undergoing treatment. It's easy to see how a lump sum check paid to you, the beneficiary, can be beneficial in these circumstances. Heart attack is the #1 leading cause of death for both men and women in the United States. It's responsible for 1 out of every 4 deaths. Stroke is the 3rd leading cause of death in women, and it's the 5th in men. So all of these circumstances, cancer, heart attack, stroke, these are all conditions that could lead to extensive therapy after the event, ongoing treatment, medications that are extremely costly to you. So whether you have a Medicare Advantage plan or maybe you even have a Medicare supplement, you can see how these These policies, the cancer, heart, and stroke policy, can be very advantageous as it softens the blow of the financial impact that comes with these illnesses. The money comes to you, and you can use the funds how you see fit. I hope you found this helpful and informative. If you have more questions, please don't hesitate to reach out. Call our office today, 316-260-3331. Also, if you'd like more information on Medicare, whether it's original Medicare, Medicare Advantage, Medicare supplement plans, drug coverage, so on and so forth, talking about these add-ons that you can use to beef up your Medicare coverage, you can call us today and request a free copy of my book, Medicare Made Simple, where we dive into all the ins and outs of Medicare and hopefully paint a very clear picture for you so that you can make an informed decision you feel confident in. Call us today. Any questions, call us and request a free copy of the book. If we can be of any help, we want to be your Medicare resource. 316-260-3331. Thanks for watching.